ഹലോ, നമ്മുടെ കൂടെ എന്നുള്ളത് ഡോക്ടർ ഷമീനയാണ്. KMC മാംഗ്ലൂരിലെ ഡോക്ടറാണ്. സോ ഡോക്ടർ ഇന്ന് നമ്മുടെ കൂടെ ജോയിൻ ചെയ്തേക്കുന്നത് വിമൻസ് ഹെൽത്തിനെ പറ്റി കുറച്ച് അവയർനെസ് തരാൻ വേണ്ടിയിട്ടാണ്. ഹായ് ഡോക്ടർ.
Hi Shaheen.
How are you doing, doctor?
Yeah, good. Thank you, Shaheen, for having given me this opportunity for creating some awareness among the women population. Thank you.
Sure, my pleasure. So, doctor, I would like to ask you, how important is a woman's health?
See, according to me, a woman goes through a lot of various stages of life. Let it start from puberty and then pregnancy and then menopausal changes. So during this entire life, throughout her life, there are so many transitions and her body goes through so much of wear and tear. So hence taking precautions and keeping a watch on how her health is progressing, it becomes very, very important there. So the only way she can do it is with regular health checkups, regular screening procedures, and more so nowadays what is it is most of the women are working women. So they find it very difficult to maintain a balance between their profession and their personal life. So I feel if she remains, now she happens to be the main pillar of the family. So if she is fine, the whole family is fine. So I'm of the opinion that women should take care, and it's very, very important that the woman in the family, the health is very important for her.
Definitely. So, what are the most common women-related problems that you attend to?
See, we come across with different age groups. So to begin with, it's like in the early adolescent period, that is mainly from 11 years, like 11 to 12 years. After that, till 19 years, we come across these hormone-related issues. So the most common in today's scenario is PCOD, polycystic ovarian disease, and then there is obesity. Then there is, because of this obesity and PCOD, there is menstrual irregularities. And if the menstrual hygiene is not well maintained, then there can be chances of infections. So that is in the early age group. Then later in the reproductive age group, that is basically from 18 to 40, 45 years. Yes, a woman goes through pregnancy. Then there are issues which related with pregnancy, which I think it's a big problem. But at that time also there are more chances, like they are more prone for this malignancies, cancers. So she has to be on the watch out for all these things. Then probably after 45 years, there is this menopausal symptoms, which most of the women have very tough time handling with their menopausal symptoms. And then there are more chances of cancer also during the later age. So these are the most common health problems which we usually come across. It depends on the age group.
Okay. Yeah. As you said, the problems during the teenage period.
Yeah.
So, what are the important factors to be considered in this period?
See, teenage period. Now there is so much of exposure, like social media, and there's so much of the lifestyle changes. Okay, the lifestyle modification is so different now that, especially during the teenage period, the girls are more prone for this obesity and other menstrual irregularities. They go through this, they have this altered habit of eating. More of them, they consume this junk food. So I feel there is a problem which, it is in the initial stages there. So I think during the teenage period itself, they should be educated about healthy lifestyle, balanced diet, and all those issues. And yes, of course, in spite of all these corrections, there are other issues to be addressed too, that is menstrual irregularities and all those things. Then they have to consult a gynecologist to rule out if there are any other hormonal issues. Sometimes there can be some ovarian cyst during the teenage period, or sometimes there could be some other some other uterine issues during the teenage period. So everything has to be evaluated. So it depends. In teenage period, that is the time where you need to be educated about a healthy lifestyle and a balanced diet. And I think that will take care of most of the health issues during that period.
Okay. So after the teenage, when a woman is preparing to get pregnant, what are the precautions or special care that is to be followed?
See, there is something called as planning for pregnancy. Okay, it's when there is planning for pregnancy, it is always the pregnancy goes on very smoothly. See, what is this planning for pregnancy is when 3 months prior you plan for pregnancy, they should consult a gynaec, and the gynaec will supplement them with some multivitamins. Usually, it will be folic acid supplementation. And then they will be assessed for any other risk factors, whether they are on the overweight side or something like that, or whether they have any other comorbid conditions. It could be diabetes, it could be hypertension, or it could be thyroid disorders. So they should be screened much before they plan for pregnancy. So the 3 months prior pregnancy, before they become pregnant, there is something called this is planning for pregnancy. So during this time, they need to work on more on their weight. If they have if they are on the overweight or obese side, they need to cut down on their weight. They need to have modify their lifestyle, and dietary changes should be done, and folic acid supplementation. So basically, this is what is called as preparing for pregnancy.
Actually, I wasn't aware of this period, planning for pregnancy. I think more women should get to know about this.
Yes. That's called as a preconception. There is a concept called as preconceptional counselling. In fact, during that counselling session, the couple will be counselled for all the risk factors which they can they are prone to, depending upon their history, depending upon their family history, and all those things, past medical history. They will be actually counselled, like what you have to do before you become pregnant. You need to correct this particular health risk factor. So everything will be counselled. So this is actually a very good concept which most of the women are unaware of. And I think this is where we have to create awareness about it.
Yeah, definitely. So, doctor, are there any specific precautions that need to be taken care of while a woman is pregnant?
Yeah, definitely. During pregnancy, the nutrition matters a lot. So when it comes to her nutrition, the pregnant patient should make sure that her vitamin supplements are not compromised. They should be taken regularly without missing any of them. And their DT shots also should be taken on time. And their food habits should be it should be modified. They should know what are the food they can consume, which is good for them. And they should know what is the food they need to avoid. There are certain food items which they have to avoid completely during pregnancy. And yes, they need to maintain hygiene, because maintaining hygiene is very, very important. During pregnancy, if they happen to have any infections, it becomes very difficult to treat them, because we cannot give them all medications. Not all medications are safe during pregnancy. Then they need to keep a check on their weight, whether they are underweight or whether they are overweight. So all those things have to be monitored properly. And they need to follow the precautions for travel also. They need to be away from all the stress factors. And yes, and some amount of moderate exercises is recommended in pregnancy, exercise and yoga.
Okay. So in teenagers, I'm going back to the teenage period. So during teenage period, nowadays, many girls are suffering from menstrual irregularities and missed periods. So how to tackle with this problem?
See, as I've told you before, Shaheen, the teenage period is a most vulnerable period when it comes to all this, the way they have exposed to the social media. They get carried away very easily. They want to follow many people, I want to follow this person, I want to follow that person. See, what happens is during this teenage period, they need to have an idea, which is good for them, which is healthy. See, nowadays most of the teenagers, they have this. They go for this fast foods and canned foods, the foods with preservatives. I feel that is where it is contributing to their menstrual irregularities to some extent. So, as a teenager, try to consume as much as healthy food. That preferably if it is fresh homemade food. Make sure your food is high on fibers, you are well hydrated. And most of the teenagers, they love drinking this carbonated drinks, the aerated drinks, which actually on a long term, it really harms them a lot. So what happens is they tend to have this obesity. Obesity, typically, they tend to have this central obesity. That is, they have more fat deposition around their tummy, which is actually not good. That is the one which causes more of menstrual irregularities and other hormonal issues. So yes, they have to, they have to have a check on what they eat and how they eat and what is that their sedentary lifestyle. So they have to be more active. They have to incorporate more of this exercise and aerobics into their routine. Because most of them are sitting in front of the laptop, or they are most on their iPhones, or it's only sedentary lifestyle. So I feel this is where they have to work on. So if they work on all these lifestyle modifications, I think to some extent menstrual irregularities and other missed periods, other hormonal issues can be tackled to some extent. In spite of all following all these things, if they still have issues with their menstrual irregularities, then they have to consult a gynecologist. Another thing is, see, the moment they attain menarche. Menarche is like the first time they have their menses. From then onwards, for 2 years to come, everybody they need some time to regularize the cycle. So we give that 1 or 2 years period for them, for their cycles to regularize. But beyond that, if it is still irregular, they have to consult it.
Okay. So doctor, how often should a woman get a physical examination or a pelvic examination?
There's something called as I've already spoken before, about screening.
Yeah.
So screening is something like where you have to have a regular health checkup and you look out for the health problems which you can avoid if it is detected at an earlier stage. So initially, let us start from age-wise. So initial age group, that is maybe after 11 to that early 20-25 years, not much of screening is usually recommended, but yes, vaccination is recommended now, which is called as Hpv Vaccine, which gives protection against the cervical cancer cervix. So this vaccination can be given after 11 years, anytime. It comes in 2 doses, which is given the first after giving the first dose. The second dose is given 6 months after the first dose. But if you are giving it after 15 years, then you need 3 doses. So that is in the initial period. But once a lady becomes sexually active, then she has to undergo she has to undergo regular screening procedures. So usually we have something called as a Pap smear. So there is this Pap test and HPV test, which is also added now. So this can be done, if it is Pap test, it can be done after the age of 21 years if they are sexually active, after the age of 21 years every 3 years. Otherwise, after 30 years, yes, it is definitely recommended for every woman.
Okay. So I think this cannot be included in a 15 minutes or 20 minutes talk. This is a very wide topic. So I'm hoping to connect with you again. Doctor, thank you very much for spending time with us today.
Nice talking to you, Shaheen. Thank you once again.
Thank you, Doctor.